Thank you, Mr. Chairman, and distinguished members of the subcommittee. My name is Casey Hite, and I'm a small business owner and vice president of Aeroflow Healthcare, a small home medical equipment located in Asheville, North Carolina. Aeroflow Healthcare is a company that my brother and I founded in 2001. We provide oxygen and mobility equipment and services to approximately 13,000 active patients in North Carolina, South Carolina, and Tennessee. We decided to enter this industry after visiting with our grandmother, who was slowly dying from chronic heart failure in a local nursing home. The nursing home was providing her with oxygen from a dilapidated oxygen concentrator. This concentrator broke down frequently. This gave her severe anxiety about the possibility of suffocating in her sleep. As I'm sure as I can tell you, that's a scary feeling. At that time, the only home medical equipment providers in the area were large corporations that were based in Florida or as far away as California. We believed there had to be a better way. I appreciate this opportunity to testify before you today and on behalf of the North Carolina Association for Medical Equipment Services and the American Association for Home Care and Small Home Medical Equipment Providers nationwide. Our company is scheduled to be in round 2 of bidding. I've heard and seen in detail round 1 problems that have plagued this high-profile program. I'm well aware of the bidding program's anticipated effects on both Medicare beneficiaries and suppliers. The Medicare bidding program is poorly conceived and fundamentally flawed. This program has shown many of the serious breakdowns that the American Association for Home Care predicted, based on the failure of CMS to recognize and account for the way that home medical equipment is provided to Medicare beneficiaries. The current bidding program will literally drive thousands of qualified home medical equipment providers out of the Medicare marketplace. One of the consequences will be limitations on services available to millions of seniors and people with disabilities. Nearly 2/3 of qualified home care providers that submitted bids were disqualified in the first round of bidding. Now, 2/3, it's a huge amount. That dramatic reduction in the number of home care providers will result in reduced access and quality of service that we currently provide beneficiaries. HME providers are overwhelmingly small to mid-sized practices that typically receive about 40 to 50% of their business from Medicare patients. The loss in the ability to serve this patient population will result in layoffs and many business failures. We've been using this term competitive bidding all day, but competitive bidding is very misleading, because CMS is radically reducing the number of suppliers that compete in a given area, resulting in market concentration rather than a competitive marketplace. The changes that result from bidding program will affect over 3 million, the first round will affect over 3 million beneficiaries. CMS has indicated that if round 2 is implemented, approximately 18 million, or about half of all Medicare beneficiaries requiring home medical equipment, could be affected. The bidding program could also quickly affect all Medicare beneficiaries in the U.S. as early as January 1st of 2009, when CMS will have the authority to apply bid pricing in non-bidding areas. The ability of CMS to apply bid pricing to non-bidding areas, especially rural areas with hard-to-reach patients, is clearly not market-based. Home care providers like my company are the front line in caring for Medicare beneficiaries. Outside of their families, we're the first person they call. If beneficiaries are not caring for themselves adequately, we're the ones that notify their family members and their physicians. This flawed bidding program will cause a major disruption in the service to these beneficiaries across the country. Beneficiaries have 3 choices. They could choose to enter a hospital, a nursing institution, or stay at home. The vast majority of beneficiaries choose to stay at home. Home care is not only the preferred choice for the patient, but is the most cost-effective health care solution. The Medicare bidding program is expected to immediately impact more than 4,500 home medical equipment companies in the first 10 metropolitan statistical areas. We believe that the Medicare bidding program will radically change the HME marketplace and dismantle this nation's home medical equipment infrastructure. If implemented in its current form, CMS will selectively contract with approximately 300 unique suppliers, suppliers in the first 10 metropolitan areas under the program. CMS's own statistics have shown that approximately 4,500 unique companies reside in these 10 bidding areas. So essentially, this would indicate that CMS intends to contract with approximately 7% of the existing home medical equipment companies. Even if we only account for the unique companies that took part in the program, which was 1,005, CMS is still threatening the financial viability of 70% of otherwise qualified, accredited suppliers in the current home care marketplace. Home care is shown to be the most cost-effective and patient-preferred type of care provided to beneficiaries. As baby boomers retire and become eligible for the Medicare program, the demand for home medical equipment is likely to increase. These beneficiaries will prefer the advancements in technology that allow them to live full lives in the home setting. Arbitrarily limiting the number of home care companies that the market will support should be viewed as selective contracting, not competitive bidding. Due to the flaws, questions that have plagued Round 1 and will certainly carry through to Round 2, we urge Congress to delay the implementation of this bidding program. We support the implementation of a rational, alternative process to determine Medicare pricing for DME items and services. AA Home Care stands ready to work with members of this subcommittee and other members of Congress to address these complex challenges and ensure the provision of cost-effective and quality home care to deserving Medicare beneficiaries.